So this is our patient. She's a 70-year-old female here for just inability really to raise the right arm over the past several weeks. She was doing some painting a couple of weeks ago, but nothing out of the ordinary. She did have some surgery in the right shoulder years ago. She doesn't recall exactly what kind. She had an MRI, an open MRI, which was not the best quality, but it discusses complete tears of both the infra and supraspinatus tendons with retraction approximately 4 centimeters for each tendon. Here's a normal shoulder with normal rotator cuff muscle and normal muscle bulk. Here's muscle atrophy after complete supraspinatus and infraspinatus tears. You can see the tears here from this posterior lateral perspective. Now we're bringing back a normal rotator cuff, which we're looking at here again from a lateral perspective. And here again are those complete supraspinatus and infraspinatus tendon tears with retraction. You can see the capsule here from a bird's eye perspective. Also, you can note the intact teres minor and subscapularis tendons. So here's our bicipital groove. And here you can see a fair amount of fluid surrounding the biceps tendon consistent with an effusion. You can see the biceps tendon. There is an effusion around the biceps tendon, which by itself has a 60% chance of a rotator cuff tear. Here you can see the deltoid muscle and the pectoralis major tendon. Now we're going to look at the biceps tendon and long axis. The right side of the screen is distal. You can see some fluid around it, maybe some synovitis as well. And here you can see a fair amount of fluid and synovitis surrounding the biceps tendon. This way? Like that. See how I'm going all the way back? Try to move, keep your hand back like that, and try to move your hand back behind you now.
I
Can't do it. Okay. Okay, yeah.
Okay.
Well, she's missing that infraspinatus. So that's why. Can't really get the whole view of the subscap because she can't really externally rotate well, but it appears to be there. So here, a subscap tendon looks fairly well preserved, perhaps a little bit thickened, consistent with tendinosis. Also, you can appreciate a small osteophyte near the articular surface of the humeral head. And I'm going to try to look at it in short axis now. Right side of the screen is inferior. Fairly preserved. She's got some interdigitation of the muscle. So here we go. Got the greater tuberosity on the right, humeral head on the left. You just don't see any tendon at all. So the ultrasound does appear to be consistent, unfortunately, with the MRI. Basically, you're just seeing the deltoid muscle going right down to the humeral head and greater tuberosity. So here's that round, protuberant, greater tuberosity superior facet. Here's I think the superior facet of greater tuberosity. And again, you just see the deltoid muscle going right down to the bone. You can see the middle facet is really not even that irregular. Probably just an acute tear that she probably didn't even realize. I'm going to go look at it now in short axis. Right side of the screen is inferior. And you can see the biceps tendon there. And again, you just don't see any tendon here going posteriorly. Basically just looking at the deltoid muscle going right to the humeral head. And again, here you can see that deltoid muscle essentially going right down to the bone in the humeral head. The right side of the screen is lateral. I'm going to try to get the infraspinatus. Here we can see the infraspinatus muscle at 1333. It's somewhat hyperechoic. Here you can see a tear, and the infraspinatus muscle is hyperechoic, consistent with atrophy. Here we are just scrolling through the superior and inferior aspects and long access to the infraspinatus muscle/tendon. And again, you can see that fairly large tear at the musculotendinous junction, as well as hyperechogenicity consistent with atrophy. Okay, so here we are at short axis teres minor on the right. You can see the hyperechoic infraspinatus on the left. And again, anechoic signal that you see in both long and short axis is pretty consistent for a tear and not anisotropy. And then we're going to go distally, but you don't see much on the other side. You don't see much of the infraspinatus. So. And here in short axis, you can see a teres minor tendon on the inferior facet of the greater tuberosity, and you really just don't see much on the middle facet of the greater tuberosity where you would expect the infraspinatus tendon.